We have our hours up there. I think I talked a little bit about that. Yes?
You may have already mentioned this, but what population do you serve? Is this also for Whitman County or just Lake County?
We get people from Whitman County, we get Lake County, we get people from Nez Perce County, Clearwater County. We have people come as far as Orfino and Cameo.
So there's really no restriction?
What we try to do when you call in is get you to the closest CHAS clinic. So if you're calling from Cameo, we'll say, hey, you know, there's a Lewiston clinic that would be closer for you. We don't deny them if they want to come to Moscow. Some of those say, I'd rather come to Moscow. And that's fine. We just always like to tell them that, yes, you could go to somewhere closer. And so, but we get, oh goodness, we'll get as far out as Henson, Potlatch, even Roselia. We'll get patients from Roselia. So.
What's the difference between the CHAS clinic down in the valley and the Snake River clinic?
Good question. The Snake River Clinic is all volunteer. That is a volunteer-free clinic. So the patients don't pay anything. But those providers are all volunteer. So you're not going to see the same provider every week. And I think that clinic is open twice a week, like in the evening from 4 to 7. And all the providers are volunteer. The nurses are volunteer. The dentists they have are volunteer. And you take a number and wait. Okay? And at CHAS, we've got regular hours, we have the same providers. You call and schedule an appointment just like if you were going to call Moscow Family. So you always know Dr. Niska is my primary care provider, that's who I'm going to see. And if she's not in, I'll see Matt because he's her backup. Snake River Clinic, you're going to take a number, you're going to wait in line, and it might not be the provider you saw last month. But the Snake River is totally free. Where we're going to say, okay, your sliding fee is your copay. Now, we're not going to turn you away because you can't pay, but we do, you know, we will send out bills, et cetera. That's a requirement, where the Snake River does not. So I think the Snake River is a really great clinic. It's providing a great need. This just provides good, solid continuity, just like anybody going to a regular healthcare clinic.
What's the dynamic between your caseworkers and the homeless shelters in the area? I mean, as you mentioned at the outset, the lack of access to health care can be related to food insecurity, trouble with transportation needs, but it may also relate to lack of affordable housing or for other reasons. So do your caseworkers work with our shelters and other?
They do. Dave tries to work with sojourners quite a bit. We try to work with health and welfare as much as we can too. To coordinate and say, you know, we're trying to find this individual housing. Family Promises of Police is another one that we'll reach out to at times if we have somebody that would qualify for that. We'll reach out to them as well. So we try to, between the social workers or behavioral health counselors and our patient service coordinator, we try to coordinate with different entities in the community to help individuals get services they need. Homelessness is a huge thing that's so hard because there's just nowhere to refer to. It's heartbreaking to see that. We see a lot of it, and you don't realize that there's that much homeless in the community, but there really is.
Yeah, I'm envisioning a 4 o'clock appointment and the person's there getting treated for pneumonia and they're going to be discharged to their car or
Yeah.
something else, you know.
And we've had that happen before.
Yeah.
We have had that. We've seen that many times, and we'll try. And what can we find for you? Is there somebody you can stay with? Where can we get you to? Yeah. That is a huge challenge.
Do you have a breakdown roughly about percentage-wise as far as your income is concerned? How much comes from the patients, which could include Medicare, Medicaid, and insurance, and how much comes from grants?
I don't have an exact breakdown of that. I can tell you that it varies from month to month. About 36 to 41% of our patients are self-pay. They're on some kind of sliding fee. The other percentage of that is made up with, private insurance. Anywhere from 10 to 12% will be Medicaid for the month. As far as the grant funding, I don't have that exact breakdown for you.
So I can say, I know at our organizational level, so about 10% of our budget is grant funding.
and that's for the big CHAS. And then Amy can give you like better breakdown of numbers for Moscow, because there's a big difference for our
Yeah.
Idaho clinics versus our Washington
That's very
clinics.
true.
As far as the way, the insurance coverage that our patients have, and that drives what kind of income we were coming in.
I would have thought that that would be higher than 10%
For the grants?
for the grants.
Well, consider, so we are really fortunate in our grant funding. We do have a lot of money coming in, but we're a really large organization. So CHAS as an organization sees over 65,000 unique patients every year. And so those 65,000 patients are coming in, what, several 100,000 times a year. So, when you look at it that way, you've got, because we're a healthcare system, we've got revenue coming in when we are able to bill Medicaid, Medicare, or private insurance.
So that's nationwide, 65,000, or just?
It's CHAS wide, so for
CHAS.
all 12 of our sites,
Oh,
we have over 65,000 patients.
and is that primarily then, I'm sorry, I was late on the yoga, but anyway, is that just in the northwest or what?
We have 12 sites, some are in Spokane County, and then down here we have Moscow, Lewiston, and then Parkston, Washington.
And Clarkston is just a dental clinic, and the one in Lewiston is just a medical, so they're standalone clinics.
Sorry to
Yeah,
keep
you're
asking,
fine.
but.
Oh, yes.
So, there's been disparate reimbursement between the states of Washington and Idaho.
That is true.
And at one point, there was more incentive to do the dental care in the state of Washington because of that reimbursement level. Is there motivation within the CHAS organization, the big umbrella organization, to have patients seen in Washington? Or, I mean, how bad is it, and is there any advocacy that you'd recommend for groups like this to, improve state reimbursement for Idaho seeking clients?
So for us, it doesn't matter whether you come to Washington, one of our sites in Washington or Idaho. The big difference is what type of coverage you have. So, look forward to a slide here. So because I feel like we're a really interesting organization to look at when you look at federal health policy, because we do have sites in 2 different states. So one of the things that we do, our patient services coordinators, is a really, really important position at CHAS. We call them PSCs. We have at least one person at every single one of our clinics who is trained to help someone to try and enroll in health insurance coverage. But we see a big difference between Washington and Idaho. So Washington State chose to expand Medicaid, so they have a really large Medicaid program in Washington. Idaho has not expanded Medicaid. So what we see at CHAS is really interesting. You can see with these numbers down here, so when the Affordable Care Act first opened up these marketplaces, and Washington State has what's called a state-based marketplace, and so does Idaho. There's also a national marketplace, but neither of our states chose to use that. So when those marketplaces first opened up back in October of 2013, that was like the first open enrollment period, we saw a huge difference between our patients who are Washington residents versus Idaho residents. So about 50% of all of our uninsured patients in Washington got coverage. Here in Idaho, only 8% of our uninsured patients were able to get some type of coverage. It's a huge difference. I'm sure you all have seen in the press over the past couple of years, we talk about the gap in Idaho, 78,000 people who fall into this gap. We definitely see that at CHAS. The majority of our patients who are uninsured have incomes below 100% of the federal poverty level. And unfortunately, the way that the federal law was written and kind of how it got enacted, if you're below 100% of the federal poverty level, you don't qualify for tax assistance to help you purchase a private insurance plan through that state-based marketplace. So that's what the gap is. It's people who are low income, they don't qualify for Medicaid, but they also can't get any assistance to help them purchase a private insurance plan. It's a really frustrating situation. There's been a lot of advocacy work. We are fortunate that we regularly go out and talk with our state legislators. They're really important to us. And we explain to them, here's what we're seeing. And so the state of Idaho has been analyzing a lot of different options of what could they potentially try to do as a state to maybe create a state-based plan to help the 78,000, but nothing has happened yet. And obviously our legislature is done for the year. So that's what we're seeing here. So definitely we have a much higher uninsured rate at our Idaho sites. If somebody is uninsured, whether they come to our Idaho clinics versus Washington, makes no difference. We use our sliding fee scale. If somebody is on Idaho Medicaid, they can still come to one of our Washington sites, and we are contracted with Idaho Medicaid. So from that standpoint, it doesn't make a difference for us, but certainly there's a huge difference in the lives of our patients who are here in Idaho and just don't have any health insurance options. It's really frustrating. And even though we do see them here at CHAS, and we won't turn them away if they can't pay, the problem is if we need to refer them out for a specialty service, or let's say somebody comes in and we do an IFOBT, which is a colorectal cancer screening, and it comes back positive, well then what are you gonna do? You know, it becomes really difficult as they try to navigate the larger healthcare system, you know, go to the hospital and they don't have insurance, so.
We see that a lot. It's a huge struggle for our patients.
Any other ACA or policy questions we can talk about?
I'm concerned about the future funding. I'm wondering if you're concerned about future funding under the Trump administration.
That's a great question. We got a lot of phone calls,
Actually,
actually,
did get a lot of phone
at the
calls,
very end of
absolutely.
last year. People were concerned, and we really appreciate that people are thinking of us and thinking about our patients. Fortunately, the Community Health Center program has had strong bipartisan support for years and years. Actually, the Health Center program nationally doubled under President George Bush, the second George Bush. He learned about health centers when he was governor in Texas and loved the model and loved that we are able to demonstrate with our data that we provide huge cost savings to the healthcare system. It's really important that we shift our healthcare system to encourage people to get into primary and preventive care, and that's what we provide at CHAS. And then under President Obama, our program continued to expand. So we're fortunate that we have that support on both sides of the aisle. Obviously, we can't take anything for granted. There's no guarantee of future funding, but right now, we feel like things hopefully will be okay. We do take the time at CHAS to go to Washington, D.C. every year, and we had one of our board members come with us this year. We meet with our members of Congress there, and then, of course, we encourage them to come visit our clinics when they're back here in the district too. So we have, actually in just a couple of weeks, Raul Labrador's regional director is gonna come visit our site here in Moscow. So we feel like that's really important. We need our elected officials to come and see what are we actually doing in a community health center. Why is it so important that we're providing this model of healthcare and these services to the patients in our community? So that burden is on us to make sure that we continue to do that ongoing education, and we certainly appreciate your all's support too. Anytime you run into one of our elected officials, whether it's, you know, local, state, federal, let them know that you support your local community health center.